this episode, we're exploring how diagnostics are evolving from a standalone service into a critical piece of healthcare infrastructure. To help us unpack this topic, I'm joined by Dr. Lizzie Tuckey, Managing Director of Scan.com, physician, healthcare executive, and leader across multiple large organizations. Welcome, everybody. I'm Demi Radeva, and this is the Akros Advantage. Lizzie, will you tell us a little bit about your career and how did you land in diagnostics?
I trained as a medical doctor, physician in the National Health Service in the UK. And I was training to be a surgeon. And I found that my real interest was in healthcare systems. I love solving problems, but I liked more the systemic problems rather than the actual surgery. And so I ended up leaving medicine. And one way or another, I ended up in health tech, and I love being in small companies and finding a really interesting problem like diagnostics and access to diagnostics, and then helping solve that and growing the company. I think it's really important for me to be mission driven and to have a sense of purpose in my career, which is why I became a doctor. And I find that working in health tech on these really interesting health problems like access to diagnostics, it's exactly my sweet spot.
Let's unpack the problem of access to diagnostics.
Yes.
How big is it? Who's struggling?
I think it is different in different countries, but in the UK, we have less scanners per capita than any other OECD country.
Oh, wow.
And we also have lots of gatekeepers. So to access diagnostics, you have to go and see a GP. And then after you've seen your GP, you might actually have to go and see a specialist. And then you can get access to a diagnostic. And because we have less scanners per capita, there's long waiting lists in the National Health Service. And some urgent scans can be, as long as 12 weeks to actually get a scan. And we are quite slow to diagnose, essentially. So we diagnose more stage 2, stage 3 cancers than any other OECD country. And that's partly to do with access to imaging, access to diagnostics. So it's really, I think it's really important that we shift from preventing access or creating gateways to open access to imaging, because earlier diagnosis leads to better treatment outcomes for patients in all different clinical areas. Whether it's a knee that you're in pain and you're off work and you can't, you're not functioning well, or whether it's a kind of cancer diagnosis. It's really important that patients get diagnosed quicker. And there's so many people who are off work waiting for scans that it's, and it doesn't need to be that way.
The backlog, are there alternative pathways to getting the scans? And
so that's really why we exist.
Yeah.
So because patients want to take matters into their own hands now. I think patients are feeling more empowered, and we exist to support the National Health Service. So patients are coming to us, they'll be waiting in a line to get a scan, and they'll come to our platform to access a scan more quickly, and they are willing to pay for it. I think there's lots of research that shows, in the UK anyway, there's a misconception between what patients think a scan will cost and what it actually costs. And so once they've worked out that it's actually affordable, then they will book a scan. And they want, a quicker turnaround. It's not necessarily same day, but they want, if you're sitting in pain, you don't want to wait 12 weeks to have a scan. You want to know today or tomorrow what's wrong.
So talk through the connection then for the physician. How do they get access to the information from the scan if it's going into a different system, or is it still the same system?
Well, one of the other problems, if you come at it from the clinician ordering a scan, is that they might work across different facilities. So they might work in one hospital here, a clinic over there, and the scans sit in those local areas. So they've got 4 different portals that they have to log into. So when we started working with the doctors, they were it'd be nice to have one place I can view all of my scans across my different hospitals. So we're able to do that because we can work with all of the scanners. We can bring the imaging and the reports into one place for the clinicians. So they have one login, and then they can see what's happening, essentially.
We've covered the patient as a stakeholder and then the clinician. Where does the government play, if at all?
The 11% in the UK, only 11% of people, and then mostly working individuals, have private medical insurance. Everybody else uses the National Health Service. So, 90% of scans are done via the government commissioning scans in the community and in hospitals. So most people, 90 out of 100, will be getting a scan in a government facility. But, and I think we are a paid for service at scan.com. So we work in the kind of 10% that want to step out of that. But I think the government has a role to play in opening access, as I described. But what we're seeing is almost the opposite. So I think, unbeknownst to maybe as a side effect of this new policy where a GP, general practitioner doctor, has to call up a national triage service in order to work out whether a patient is allowed to be referred for a specialist, just creates more barriers. So in a way, the trend is going against us in terms of health policy and government policy. But I don't think that was an intended consequence. I think it's an unfortunate consequence.
Do most people or even clinicians misunderstand about the role of diagnostics when it comes to patient outcomes?
Yeah, so I think new clinicians are actually taught clearly around what they can and can't order in terms of imaging. Some pathways, some clinical conditions will have a clear pathway, like prostate cancer or prostate screening. First do a blood test, then do a CT scan, that's very clear for a clinician. But a GP, for instance, they don't have that clear, like, after these three things, order a scan. And I think certainly when I was at medical school, we're not really taught about when to bring in a scan across all different pathways. And I think in the UK anyway, general practitioners don't really refer that much for imaging, whereas in other countries, they do use it for imaging. So that creates delays. So I think educating the GPs, the general practitioners, on when they can order, when it's appropriate, and how to ask for imaging or what to write in a request so that you get the result that you want would be really helpful.
Is it standardized or is it different for each clinical commissioning group or each trust or each hospital? Do they have different processes?
Yeah, it's really different. It's different in what the trusts have commissioned. So some areas will have really good, like, musculoskeletal pathways for joint pains, and they'll enable like primary care to order imaging, whereas others won't have anything. And so it's not standardized. And when I talk to my friends who are GPs, they don't feel comfortable ordering imaging. And I think that's something that we could really work on, because I think they are a key to making sure that patients, they shouldn't feel afraid about ordering imaging, and they should feel, that it's part of their job. And I think if we can do that, that will open up more, and it will get patients faster access to diagnostics. I think specialists they understand more about when to order imaging, because they're quite niche in their area.
So we opened with a capacity problem that you mentioned, UK versus other countries. And then it sounds like there's a bunch of other problems, including lack of standardization. So when it comes to diagnostics, what are all the different issues that you're facing? And maybe give me some cases where you've solved for that through
Sure. I think imaging, the main problems are, tech. So it's the last service out of all of the services that hospitals offer that is getting tech transformation, turning digital. So most hospitals are still using like paper forms. And I know in the US, you guys use paper forms plus CDs. So images are being transferred with CDs. I mean, it's not that, and faxes. So
even I've received flashcards, all kinds of things. Yes.
It's a digitalization problem.
Yeah.
We need to move to electronic orders. We need systems to communicate about the orders to each other. So there's an interoperability problem there, because every single practice has a different system. In terms of the diary, like actually even booking, like these radiology platforms sit on different diaries and they don't have like open access to scheduling. So you can't actually book online. So that's a bit of a disaster. So you can't share capacity across a market because you can't access, you don't know where the slots are. So there's this digitalization piece. And then I think on the actual scanner itself, I think there's lots of tech. So there's loads of AI that can be used to enhance images, to shorten the scan time, to increase the capacity of the scanner. And that is happening, but that has been a real problem that, these older machines are slow, the resolution isn't good. And so we need to kind of bring tech into that area. And then I think on reporting, I mean, you've probably seen a lot today here at Health around how AI is transforming loads of areas. But I think AI is very good at picking out pathologies and comparing with old scans that enables a reporter to be faster and to be able to do more. I don't think it replaces the clinician, it assists the clinician. So bringing, tech into that area is really key. And the other thing I think is about patient understanding. So when a patient's asking for a scan. They're more interested in understanding the results rather than the clinician being in control of all the data. And so they want to understand the reports, and there's a problem because they don't, because they can be quite technical. The language is technical. So we've solved for that by introducing it's not AI, but it's a kind of simplified report that's created automatically, consulting a dictionary that we have and producing beautiful images around, medical jargon, essentially, so that patients can understand the results and really, get to grips with them. So I think those are some of the areas that we've seen problems and we've started to solve them. And then obviously we've spoken about the front door, like the access problem, which we're kind of creating. So what we've solved for there is we allow patients to refer themselves. So there's no gatekeeper to our service. It's self-referral. So you can ask me, I can book you a scan, or you can book yourself a scan. And then behind the scenes, we will make sure that scan is appropriate and, that kind of thing. You can self-refer yourself in. And I think that's going to be key to the access problem going forwards, is just removing any barriers at the front door.
Is there companies that you saw or ideas that you think get you excited about the future of diagnostics and kind of what's the next frontier?
Yeah. It's an interesting one. I think quite a lot about what the future of imaging is, because the MRI was invented in the 1970s and hasn't really changed that much. I mean, it's got a bit faster, it's got quieter, it uses different cooling devices now, but it hasn't really changed. So what is the next thing? I think when I look into the future, the message and signals I'm getting back are that it's more around the MRI won't be probably replaced with another kind of like that type of imaging. I think it might be that we use cellular imaging. So we're, looking at cells more, better ultrasound, looking inside the body, at a cellular level rather than, MRI, like these kind of CTs changing themselves. Although I don't know. In terms of what I've seen here, there's lots of AI and examples of AI in reporting, which has been great to see. But obviously, I think we've known about that now for quite some time. I've seen quite a few new imaging modalities. So sort of more handheld, patient-led imaging, like there's an eye scanner here. There's a kind of breast ultrasound that you can, buy in Boots or Walgreens. Yeah. So I think there's this kind of commercial, like consumerization of diagnostics, and the at-home market is really
growing.
Yeah, it's really growing. I mean, you can buy quite a lot of stuff now in Boots, which is amazing. So I think we'll see that grow too. But yeah, I haven't got my finger on exactly what's coming next, apart from the idea that we'll be able to see more into the body using kind of cellular diagnostics rather than, taking photographs of the and looking in like that and building up images. In terms of like MRI tech, there's a lot coming out of China and India now. And so I think that's going to shift the market as well, because there's more competition on machines. So I think that's a really positive thing that's happening.
How is that going to impact, if at all, the sort of strategy for Scan and what's next? Do you become the platform that democratizes access to all these types of tools?
Yeah, I think so. So. We're really keen. We've added lots of services. So we did actually start just doing MRI, but we've had lots of demand to kind of move into different services. And I think we do need to bolt on diagnostics, like it's wet and dry diagnostics. So we do dry, which is scanning, but I think we need to move into just support access to wet diagnostics, which is pathology, blood tests, all of those things that I've been talking about, some of the tissue diagnostics that I think will be what we use in the future. And there's already quite good evidence that circulating DNA can actually provide earlier indications of like recurrence in cancers and things like that. So I think we'll see more and more of that.
Was there anything that I didn't ask that you would like to share with our audience?
No, I mean, we do actually have operations in the US.
Yes.
So you may see us, we're in 13 different states in the US now.
How are you approaching the US different, or what are the problems that are different there? Or do we have the same problems?
US, you do have the same problems, but I think it's reversed to the UK, but in terms of the way that the market works, because most people are insured. And so it's an insurance-led market in healthcare. Yeah. We work a lot in after the event insurance in America. So we're dealing with people with accidents and need their injuries assessed. And so that's a bit different. Though we don't have a direct consumer business in the US. And I think the consumers are quite well served maybe in the US, and they're not all out there looking for scans because they're waiting to be seen. So that bit of the market is different. But I think fundamentally the infrastructure is the same. Like it's there's a lot of innovation that can happen in the way that we book, communicate, scan, and report. There's a lot of innovation that can happen there, but how the customer books, is a bit different.
Well, thanks so much for joining us, and
Thank you for
I hope
having
you
me.
guys enjoyed this. Thank you for joining us for this episode of the Akros Advantage. Healthcare is one of the most complex industries in the world, and every conversation in this series explores a different piece of that puzzle, from innovation and patient experience to commercialization, investment, and systems transformation. A special thank you to our guests for sharing their expertise, experience, and insights with us. If you enjoyed this conversation, be sure to subscribe, follow along, and explore additional resources from Akros Advisory, including our newsletter, where we help healthcare innovators navigate the path from idea to impact. Until next time, keep asking better questions, challenging assumptions, and building solutions that create meaningful value for the people they serve. I'm Demi Radeva, and this has been the Akros Advantage.